Great news. We talked to Dale's parents and doctor. He's doing remarkably well for what he's been through. And this is a miracle. But that water was cold. So for those 25 minutes where presumably Dale had no heartbeat, there was really no new oxygen flowing to his brain. How could Dale survive? Well, the theory is that hypothermia protects the brain. And this is something we're using in medicine now, therapeutic hypothermia. So normally, when your heart stops beating, you're not getting any oxygen to your brain. There is still a little bit of remaining oxygen, but there's a problem, and that is if our temperature is normal, 98.6 degrees, what can happen after you're revived is that oxygen, as it gets to your brain, can actually wreak havoc on your cells. It forms all these free radicals, and it can actually kill your brain cells. And that's what you're seeing there. That's a brain cell that has essentially been destroyed after you get your heart rhythm back. So what we've learned now in medicine is if we cool patients down, in this example below 90 degrees, those cells, the metabolism of the cells in your brain and other parts of your body slows down. So you don't need as much oxygen. And when oxygen is reintroduced, when the heart rhythm is back to normal, your brain cells slowly, as you come out of that hypothermic state and we raise your temperature back to normal, they will have survived the insult of having no heartbeat. And this is something we're learning more and more about. In my hospital, therapeutic hypothermia is now a new protocol. There are plenty of hospitals that still don't do this because it's so new. And we actually have a guest to further explain this theory, Dr. Benjamin Abella. He's the clinical research director at the Center for Resuscitation Science on Polycom. And Dr. Abella, this is such an exciting development in medicine, but of course we've learned that we've probably been doing things the wrong way for many years.
Yes, that's right. And our research has shown that if you employ this cooling therapy, therapeutic hypothermia, you can double the chance of people surviving and greatly improve brain function and recovery as well. Right now, we estimate that maybe about a quarter to a third of hospitals offer hypothermia as a treatment after cardiac arrest. The American Heart Association has endorsed this therapy. There's good science behind this therapy. The problem is it's not as easy as it sounds. There's some work to be done. You have to have a protocol, you have to have training. And so it's actually been slow to spread to all hospitals. And my fear is that many patients end up at hospitals after a cardiac arrest, and this therapy may not be offered.
Is there any limit to how far we can take this therapy?
Well, that's a great question. And right now, we just don't know. But I will say that one of the exciting things about this therapy is it's really redefining the way we view life and death. In that it used to be you were alive or you were dead. That boundary zone is growing and growing. And now there are many people that I've personally had the good fortune of talking to who were clinically dead for 30, 40 minutes, even up to an hour, and they return to their families, they return to life. That would be unimaginable 20, 30 years ago.
Dr. Bell, thank you so much.